Well, welcome back to Health Made Easy, everybody. We are super excited to have a pediatrician. This is going to be our first pediatrician being on the podcast. This is Dr. Nelli Gluzman. Am I saying that correctly?
That is correct. Thank you so much for having me on.
You know what? I'm from South Alabama, so my English is kind of like a second language, and I'm glad I nailed that one. So that's really good. So we introduced you in the intro to the podcast, but what I would really love for you to do, Dr. Nelli, is just introduce yourself, kind of tell us about who you are, not only as a physician, but also, just sort of as a person.
Thank you for the chance to do that. It's a really quite big honor because I'm a huge fan of your podcast and your work.
Thank you.
So I have two names. It's Dr. Nelli Gluzman, and a lot of my patients and friends call me Dr. Mom because I'm a mom and I have an 8-year-old daughter, and I have a holistic pediatric practice in New York, and I came to have a holistic pediatric practice, which is a little bit of a different, non-conventional approach, because I saw how when my daughter got sick and kept getting sick and had all these chronic illnesses, that conventional medicine, which was what I was practicing for many years in the hospital setting, it just wasn't enough to be able to keep her healthy. And so Blossom Pediatrics was born from that. I incorporate a lot of different practices in Blossom. That includes functional medicine and integrative medicine, looking at the root cause of disease, reversing that, and looking at the whole person, not just symptoms, but the whole person. And a lot of that comes from gut health. And I know you talk so much about that on your podcast. You did a whole series and it was amazing. So I refer you viewers for more information on the nitty gritty about how the gut works by listening to other episodes. But I'm deeply passionate about my work, and I try to live what I preach, but I'm also a human and I'm a busy mom, a busy pediatrician, and I have 14 chickens now. So it's making me even busier. I'm a mom of 14 chickens. Yeah.
Maybe your 8-year-old can help you with that.
She does, yes.
Yeah. So I know that one of the things that we're really going to dive into today is we're going to be talking about, what doctors really don't know about the root cause of diseases, and, versus what, you and I would call like a Band-Aid solution, or basically like treating symptoms or something like that. Can you talk about just sort of briefly an overview of the difference between that, but also what's the difference between conventional pediatrics and then what you do and kind of how those work together?
Great question. So let's start by talking a little bit about what conventional medicine means and what holistic medicine means. So there are many different ways to approach this kind of difference in practice. Both are so important. Mm-hmm. Conventional medicine is kind of what we refer to as modern Western medicine. Typically, a physician would first go to a medical school and then to do a residency where they get trained really well to save lives. And that's what I was doing really well, working in a hospital setting with the sickest hospitalized kids. So I would be able to get a really sick child who might be coming into the hospital with pneumonia or an asthma exacerbation or really bad infections. And we use medicines that save lives. They're life-saving treatments. These conventional pharmaceuticals and modalities save lives. There's no doubt about it. They are needed. There's a place for them. When there's an emergency, this is where you want to turn to. Yeah. That's conventional medicine. But what are we doing at the same time to make sure that this doesn't happen again? And I found through my personal experience with my daughter, not knowing how to make sure that every little virus wouldn't turn into a bacterial infection, or if her rashes needed more than just steroids to cover up symptoms. Like, how do we make sure as families, as people, as parents, as humans on this planet, how do we make sure that we don't get into the same problem over and over again? I started to notice that not just my own child, but so many patients were coming in, so many kids were coming in with things that were not really very common even 10 years ago. Kids would come in with more and more asthma exacerbations, eczema, wheezing all the time. They would have rashes all the time. Allergies became kind of considered normal, whether they be environmental allergies or seasonal allergies, things like hay fever. More and more kids needed to be on steroids 24/7, whether on their skin or inhaled or as pills, just to keep down the inflammation. And by seeing that there's a big problem, and I'll get into the numbers shortly, they're pretty staggering. I decided that I just couldn't stand back and only use Band-Aid solutions to cover up their symptoms. We can do so much as practitioners to literally give our kids and ourselves the tools that our bodies need to reverse illness. And that's what I consider holistic medicine. Giving a child or an adult the building blocks they need to heal, support a body so that it's able to help itself. That's the difference between conventional medicine and holistic medicine.
Love it. Love it. Yeah, and it is exactly what we teach in our office as well, which is the body really can heal itself. It just needs the building blocks to be able to do it, but it also needs to either remove or eliminate the things that will interfere with its ability to, run and operate the way it was designed to do.
I'm so happy to hear that this is what you do in your practice, but I'm so surprised when I teach medical students, resident physicians who are doctors in training. This question doesn't really come up very often, and so I'm very often reminded that these root cause approaches are not typically covered in conventional medical systems.
Mm-hmm.
Even seasoned specialists, doctors in training, they really can't tell me what the root cause of asthma, allergies, and eczema is. Very often you'll hear practitioners say, well, there's a genetic component, so your genes are responsible for these problems, and that's about it. And you kind of just got unlucky. And when you ask as a well-meaning parent or an adult patient, well, what can I do to make sure that I don't have this symptom of whatever that is? The solution is often, here's a medicine, it's going to treat your symptom and you'll be okay. And yes, they are correct. It will treat the symptom. But are we approaching the question of what can we do to make sure it doesn't come back? Are we getting to the root cause? I have so many examples of that.
Yeah. I mean, it's very much like, I sort of look at it as a child, you have an 8-year-old, and certainly when they were younger, and my kids are a lot older. So when they're younger, they always ask the why question, all the time. And I think in natural medicine, chiropractic care, acupuncture, functional medicine, things like that, we just sort of never lost that. We are asking, well, why is this happening? And they're like, well, it's because of X, Y, and Z. And if it doesn't line up and it doesn't make sense, we just keep asking that question until we actually get to what the root cause, is. And I find it fascinating that you brought up asthma. My wife was an asthma sufferer for years, and she was a 2-puff-a-day inhaler user. She would wake up in the middle of the night, wheezing for air and just like scare us half to death, But I mean, she hasn't been on an inhaler for like 20 plus years, at this point. But I think most people don't know that they think of asthma as this constriction of the airway, and a lot of them are that, but also if you open it too wide, you can't breathe either, So it's the body's very, very dynamic and very, I guess has to function the way that it was designed to do so that we can actually be well. So let me ask you this: when you look at the things that you take care of on a regular basis, like let's take maybe allergies, or maybe it's eczema or something like that. What are you looking for when you're looking for like root causes, or where are you finding the root causes primarily?
Great question. Well, first let's take a look at how severe is the situation right now with children. Okay, These are numbers from the CDC. They are most up to date, okay? So for eczema, another name for that is atopic dermatitis, about 10.7% of children, that's 10.7%, have eczema, okay? Asthma, 7.5% of children in the US have eczema. That's a staggering number.
Massive numbers.
Mm-hmm. Hay fever or seasonal allergies, 7.2%. If you look at an average classroom, which is about 30 kids in the US, about 2 kids in every single average size classroom in the US has a severe anaphylactic food allergy.
Wow.
So by the definition of what an epidemic is, this is an epidemic of chronic childhood illness. So we need to figure out why, right? And as with many, many things, there are many reasons about why this is happening. Mm-hmm. And although the numbers are pretty scary, the good news is that once we understand why, then we could do so much about it. Well, there are a lot of myths circulating about why this is happening. Let me give you some examples of why it's not happening. A lot of practitioners, as I mentioned, say that it's just genetic. And yes, absolutely, there is a genetic component to these issues. There's a genetic component to everything. But we've known for about 20 years with thousands of studies that epigenetics it's the study of how the environment impacts genetics. Mm-hmm. Is so much more powerful than genetics. And so that's extremely empowering. And if families don't understand that there's so much that could be done because we could influence our genetics by changing the environment, both inside our bodies and outside our bodies. Yeah. If we understand this, then we could reverse a lot of these chronic illnesses. Another myth that I see circulating is that the best kinds of medications are the ones that reduce inflammation. So if you're someone that suffers from eczema or frequent rashes or atopic dermatitis, you will get a prescription for a steroid cream that goes on your skin. And yes, absolutely, it will work. It works really well. It will definitely bring you relief, but it will not bring you any permanent relief because the steroid will have to be applied over and over again. And very often, you'll need more of it and more of it. And children are extra sensitive to the toxic effects of these steroid creams. Yeah. Let's say you, like your wife, have asthma, and sometimes you need to rely not just on albuterol, but on a steroid to calm the inflammation in your lungs. Well, this is a temporary Band-Aid fix. And so we do need to use these medications. This is what, when somebody lands in a hospital, yes, this will save somebody's life. It will make sure that a child is breathing. But without addressing the root cause, you're not really helping anybody in the long term. This is a temporary Band-Aid solution. Another myth that I want to propose to you is that there's really kind of an idea that children will just outgrow their eczema, asthma, or allergies, which is, yes, it is possible to outgrow, but it is unlikely that somebody will outgrow these things, especially eczema, if you're not changing the environment. And this concept could be empowering when you know you can make a difference and change, and this will impact your child's future or your own future. But it could also be very disempowering to just sit around and wait for your kid to outgrow something. It's not only scary, I've been there as a parent, and frustrating, but it's, I think, dangerous to just wait. On the topic of outgrowing, if 10%, I mentioned that 10.7% of kids have eczema right now, and 7.3% of adults have eczema. So who's outgrowing this? If you're looking at asthma, for example, 7.5% of children have asthma, and 7.7% of adults have asthma. So who is outgrowing this? And so we need to look at the root cause. And the root cause has many, many different approaches. But what I found to be the most important baseline foundational approach to treating and reversing these chronic childhood illnesses is to look at gut health. Yes, there are many culprits. It's multifactorial, but all roads tend to now in the Western world lead to a breakdown of gut health. And that's actually a good thing because there's so much you can do to reverse that, as you know.
Yeah, and I want to get into that, but I do want to ask you your thoughts on this. And could you talk about the difference between treating root cause and just putting a Band-Aid solution on there? We can see the same thing happening like in functional medicine, where we're just trying to lower inflammation with omega-3s and turmeric and, and all these, and just supplement a person. And there's places for supplements, and I'm a huge supplement fan. If most people saw what I took every day, they probably think I was a hypochondriac, but we do see that happen where we're trying to do the same thing as the pharmaceutical is doing without getting to, like you're like we're about to talk about what is actually the root cause. Do you see that same thing happening? People coming in and they've got bags full of stuff,
Yeah.
they've been trying.
Yeah, I actually have a really great example of this. So how many of you listeners have needed to take medication for heartburn, or otherwise known as reflux, occasionally, or maybe even every day, that was blocking your acid production? So those medications, which by the way work really well to block acid production, those medications are things like PPIs, or H2 blockers, for all you listeners that are know your pharmaceuticals, but there are many different brand names for them that are sold over the counter. Those are Zantac, Protonix, Pepcid. I'm sure you've heard of all these.
Mm-hmm.
These are used for adults and children when they have heartburn. How they work is they literally stop acid production in the stomach. So that's a Band-Aid solution. We know it's going to work. It works really well. But what does it do to make sure that you don't get heartburn again? What the opposite of the other end of the spectrum of approaching it from a root cause perspective is, why do I have so much acid bursting into my esophagus? Yes, some people do have anatomical variations, and this is rare actually, but their anatomy kind of makes the tone of the lower esophageal sphincter, which is the muscle that keeps everything in the stomach without shooting up through your esophagus. Most people have a stomach that doesn't have enough acid, and it has to churn so much harder to digest food. So when you're stopping acid production by taking a pill, you're not only making the situation worse by temporarily treating the problem, but ultimately your stomach will need to digest the food that you put into it by producing even more acid, and you get into this cycle of eating more and more medication, having more heartburn, and having more discomfort. That's also dangerous because you need to have a certain acidity in your stomach for all the enzymes to break down the food.
Oh yeah.
In the long term, you're not able to break down food properly. The food that is broken down, because it's improperly broken down, is not giving you the nutritional value that it needs. You end up having food that your microbiome can't manage that. And so because the acidity is not the right kind of acidity, you're artificially changing it. And all the enzymes in the body do need to function at a certain pH level. So using a medication like this once or twice is okay, but so many people are on these medications every single day to stop this symptom. What is the root cause approach to this? It's pretty traditional. Most modern cultures would use something called bitters to help increase the stomach acid production to help you digest food. This actually changed my life. This is one of the first things that happened to me that kind of got me on this path. I had no idea, even as a pediatrician, that increasing my stomach acid production would help me digest my food better, and I wouldn't have as much heartburn.
Mm-hmm.
It saved my life. And I want to kind of scream it out to everybody. Think about the root cause approach. Sometimes modern medicine or conventional medicine doesn't look at reversing the symptoms from a root cause perspective, but rather wants to just get rid of the symptoms without thinking about the future. Yeah. And that's one example that I have.
Gotcha. Yeah, it's interesting, and we teach that quite a bit. I know you do as well, which is if you ultimately handle the cause of the problem, the symptoms will just handle themselves, because they're downstream. So we're sort of always looking upstream as to where is this coming from. you know, and then when you can reach up there and you can address that, then everything downstream just sort of straightens itself out. And I'm glad you brought up how, you know, basically having poor stomach acid production, which is, you know, sort of the top end of the funnel for digestion, is just going to dramatically impact everything from there south. You know, even though it's sort of like the smallest, you know, in terms of like the size of the digestive tract, it has the biggest impact because it has to go through there first, you know. So it's a lot like for us as chiropractors, you know, the first bone in the neck is the most important because everything has to flow through that. And if that one's in trouble, the communication is terrible, you know,
Yeah.
the rest of the way. So, and there's so much stuff that we could dive into in terms of that. One of the things I want to jump into is, so let's say, I know catching these things early is really advisable if we can do that, but oftentimes we don't do anything until they're like full blown terrible. You know, we just kind of push them off and then maybe it'll go away, maybe they'll grow out of it, maybe all those kinds of things. Are there some subtle signs that our listeners can look for in their children that may be somewhat unconventional signs of like maybe digestive distress that could lead to allergies, that could lead to, you know, skin ailments and those kinds of things? What are maybe some subtle signs that they can look for?
It's such a great question. I am so glad you asked that. So there's something called the atopic triad that we see very often in medicine. And usually it starts with like a mild allergy with kids, a mild allergy, maybe seasonal allergy, maybe it's a dog or cat or dander or dust, some kind of usually normal grass or pollen or beautiful tree that's causing allergy symptoms seasonally. Maybe it's having eczema periodically, eczema flares. And so you treat that. And that, what is an atopic triad is, if you don't address the root cause, you'll have more and more allergies, which could turn into anaphylactic food allergies, which could eventually turn into asthma. And so those eczema, asthma, and allergies go hand in hand.
Okay.
Having one increases your risk for having the other two. And they all kind of come from the same problem. Very often it's gut health. But you mentioned something called what I consider to be soft signs. And when I have my patients in my practice fill out the first forms, I have them look at the inventory of all their kids' soft signs, with a caveat that some of these might be completely normal occasionally. But the point is, if they're happening very often and they're interfering with a child's livelihood and thriving, I ask parents to be really honest with themselves when they do this inventory, because these are soft signs that there is usually inflammation in the body that shouldn't be there. And if that's not addressed, then that could lead to a whole plethora of big time problems. So some soft signs, and you parents are there, please be honest with yourself, even if it's a little bit uncomfortable. If you have a child who's having frequent visits to the ER or urgent care because of wheezing, like let's say they have a cold and they start wheezing and they need to have a lot of albuterol to open up their airway, or maybe you're using albuterol frequently at home, or that might be a soft sign that there's a bigger underlying problem that needs to be addressed before it gets worse. Other soft signs that I see very frequently are digestive issues. Does your child get bloated all the time? Are they complaining of belly pain very frequently? Is it keeping them home from school? Are they going to see their nurse in the school very often? Are they constipated? Are they having loose, watery bowel movements all the time? Now, again, occasionally, this is normal, we're humans. But if this is something that's starting to interfere with everyday life, this is not a normal way of being. That's a soft sign for a bigger underlying issue that needs to be addressed. Other soft signs that we see very commonly in conventional medicine are having dark bags under the eyes, or something called the salute sign, which is like a line right above the nose crease, which happens when a child has a runny nose all the time, usually from allergies, and they're kind of wiping their nose very frequently. That's called the salute sign. You can look that up. That's a soft sign as well. Or what about a child who perhaps I actually consider allergies a very big soft sign. So if you have a kid who needs to have a medication seasonally to get them comfortable enough to go outside, whether all those over-the-counter allergy medications, that's a huge, that I think that's a hard sign that there's something wrong and it needs to be addressed, because ultimately if it's not, what happens is it will get worse. And if you follow the numbers that I gave you, the kids who have those soft signs turn into adults who have bigger underlying problems that come from a lot of inflammation in the body.
Okay, gotcha. So I'm glad we got to that, because that kind of leads me into my next question, which is, a lot of times as parents, depending on where you live in the country, you may not have access to somebody who's a little bit more holistically minded or runs a holistic practice. But let's say they are, and certainly in this day and age, with everything that's happening, telemedicine is becoming more prevalent now. People can go have tests done. The doc, who's thousands of miles away, can interpret the tests and then start to work with that individual. I mean, I did that years ago with different doctors, and it was like taboo at the time to be able to actually do it. And I was the patient, but I didn't really care. And I find most parents don't really care either. They just want their child to be well, and they want them to be healthy. So when someone is looking for a holistic practitioner, what are some of the things that they should be looking for, whether it be a characteristic of that practice or maybe questions that they should ask when they call that practice or message that practice, so that they know they're reaching out to the right provider?
Oh, that's a great question. Okay, here's what I believe to be, actually, this is what I consider to be the heart of my own practice. And if you're in New York, then there's a lot of opportunity there to see a holistic practitioner. If you're outside of New York, I would suggest, or even with your own pediatricians or your own practitioners, there's probably 6 questions to ask when you're choosing a practitioner, if you want to look at it from the root cause approach. So the first is, does your practitioner believe in treating and healing the root cause of the problem rather than simply placing a Band-Aid on it? So we talked about that. If the solution is a Band-Aid solution, that's okay. But does the root cause also get addressed? So that's one thing. Another a question to ask is, does your practitioner recognize the amazing body's ability to heal itself using powerful natural remedies? Another question to ask is, does your practitioner realize that every person or child is different, and so it works with you to kind of make a plan that's appropriate for them? I see this a lot in pediatrics, actually. A lot of times, a lot of approaches are one-size-fits-all approach that's based on protocol, and a lot of the heart that goes into medicine is lost. Yep. Just because you have to check off a box, for example. I am completely against that. I believe that every child is an individual and every child's story is different. And so that's how we, as practitioners, I think should all be practicing. And so if your practitioner is not, recognize that. Another question to ask when you're choosing a holistic practitioner is, does that practitioner practice whole body medicine? If this is something that resonates with you, I encourage you to think about that as part of medicine as well. The body and the mind and the heart is one big continuum. I'm happy to see that conventional medicine is starting to pick up on that we could influence so much of our immune systems through our heart and through things like mindfulness, and through connecting our mind and our heart and breathing, and the whole mindfulness world is really emerging in conventional medicine. Let's see, another question to ask if you're a practitioner when you're choosing to work with somebody is, do they acknowledge conventional medicine using evidence-based practice? What that means is, are they looking at all the data? So we're not just doing kind of what we think is working, but we need cold hard data. That's the advantage of conventional medicine, that we need to have double-blind, placebo-controlled, top-notch studies to show us that the choices that we're making are good choices that actually work.
Yeah.
And finally, does your practitioner aim to reduce medications overall? I mean, is the goal to wean you off all the pharmaceuticals little by little? So I think those are general kind of guidelines to look for when you're looking at a more holistic approach.
Okay. No, that sounds really good. And I'm with you, you know, on the lowering the medication. And I think most people, that's where they are. Because I think you and I hear that a lot. People are just like, I hate taking medications. I don't like taking them. I don't want my kid taking them, those kinds of things, but they're on like 17 different ones. You know what I mean? Even though they don't like it. But there's no option, you know, possibly for that. And I'm glad that, you know, you actually have, you know, sort of criteria and questions that people can ask to actually be able to discern, you know, a good holistic physician. Because a good holistic physician is going to look at the person as a whole. There is, like you said, there is no one size fits all. Individual healthcare, individualized healthcare is where everything is going. And those that don't embrace that approach are going to be left behind because they're just not going to be able to help they're not going to be able to help people because they're trying to put everybody into a little box, and it just doesn't work like that. So,
yeah.
So if we're going on the gut health part, as we kind of start to wrap up a little bit here, if you had to give folks like their top 3 things that they could do at home with their kids and for themselves as the parent, you know, because I feel like you cannot set up a separate paradigm for the child. You know, it's like you do this, we do whatever we want. I think that's totally unfair. That's just my opinion as a parent and also as a practitioner. I think everybody's got to be on the same page. So if there was 3 things that families could do at home to improve their gut health, what would be like your top 3 things that you would have them do?
Oh yeah, I mean, I do recognize that it's overwhelming. Sometimes families don't know where to start. But there's so much information out there. I get overwhelmed sometimes with the amount of information, amazing, great information out there. When I take my families, and when I say family, it's really, my patient is really the child, but very often the whole family hops on board because they want to support their child.
Mm-hmm.
And so it ends up being like the whole family is getting healed. When I take my families through, it's called the Rescue Your Child's Health Program. It's a 30-day program to start reversing asthma, eczema, and allergies, and any other chronic disease that comes from gut health problems. So there are 3 different ways kind of to approach it generally. The first is help the body detox. And what that means is detoxify your home, make sure that there's nothing around, not nothing, but minimize the amount of toxins in your child and in your environment to kind of lower the bucket of toxic overload in a body. A lot of people, a lot of practitioners do believe that when you see symptoms, it's the body can't get rid of the toxicity fast enough. So we want to minimize that while also supporting the body's ability to detox naturally. And with children, you can't just use medicines that are made for adults, a lot of pills that might be holistic, but they're aimed and tested only on adults. So everything that's done for the child is the most natural, holistic way, and that could mean detox baths or drinking certain teas that are completely local or organic and effective. They help the liver detox, they help the kidneys flush, but they're not some formulation made in a lab. These are natural herbs and botanicals that empower the child's body to detox. So the first approach is lower the toxic overload.
Gotcha.
Second is literally heal and seal the gut lining. This is the cornerstone of the program. We want to heal and seal the gut lining so that it could support a healthy microbiome. This is very often done in a lot of traditional cultures, but we kind of don't do this anymore. We want to eat literally what our gut lining is made of, because very often when you see a child who has eczema, asthma, and allergies, or digestive issues, the gut lining is severely compromised, and it's starting to let a lot of different particles or antigens into the gut lining and into the bloodstream. So we want to, these are the really fatty, healthy foods like bone broths, chicken stocks, meat stocks in general,
Yeah.
different kinds of healthy fats. We need those foods in our child's guts to heal and seal the gut lining. And the third approach is to restore the microbiome to a more diverse and healthy microbiota. We want the good bacteria that literally helps protect us from the bad bacteria, but also helps us digest our foods, helps us detox. Without a healthy microbiome, we cannot function as humans at all. We get sick really quickly, and the best way to do this with children is to literally eat the microbiome. And this is fermented foods, lots and lots of fermented foods. And when I take kids and families through this program, what I see very often is significant reversal of even allergies, which are considered not to be reversible, but they are in fact very much reversible. Kids who've had anaphylactic allergies to peanuts and really couldn't eat many foods, significant restrictions, had to go everywhere with their EpiPen, always worried about birthday parties or what's in that muffin, not need to carry an EpiPen a year later. That's the power of holistic medicine, and that's the power of gut health, restoring gut health. It's so powerful. Eczema flares would just disappear little by little. And of course, everyone is different, and sometimes it takes 30 days, sometimes it takes a year, but ultimately you're making sure that your child is not going to be an adult that's having these issues.
Yeah, absolutely. It is so much easier to raise healthy kids than repair damaged adults. I mean, it's just how it is. And they heal so much quicker and so much faster than we do as adults. They don't have, 30 years, worth of trauma and bad choices and those kinds of things, whether we knew we were doing it to ourselves or not, but while we have control over it, sort of as the parent, and we can really transform our children's health, it does set them up for, an amazing life, and a lot of, warding off a lot of unnecessary suffering for them. I mean, I could talk about this with you all day. I just geek out on this kind of stuff, but I do know we have to wrap it up. And I want to put a link to that program in the show notes for sure. But I also want you to tell our listeners how they can reach out, how they can find out more about your practice, how they can find out more about you and all the really cool things that you have going on.
Oh, thanks. It's really simple. My website is blossompediatrics.com. And there you can find all the information, including the Rescue Your Child's Health program. It's a 30-day live course, and it's for everyone, not just for my patients in New York. If you find yourself to be in New York, you could also book an appointment on my website. And this is probably the best way. I also host a Facebook group for healthy and holistic kids. That's the name of it. It's really fun to be in. I love hosting it. So that's where you can find me.
Cool. Well, I certainly appreciate you coming on the podcast. It's just been an absolute privilege and an honor to have you on here. And I just want to say thank you for what you're doing because for our listeners out there who aren't in the natural health space, they sort of don't live in that world like you and I do. These kinds of practitioners like Dr. Nelli are rare, unfortunately. There are more and more of us that are coming around every day, and other medical physicians like herself who are transitioning into functional medicine, transitioning into more root causes. But I just could not be more grateful for, not only what you're doing, but just sort of because I know what it takes to stand your ground and to run a practice like that. And it is not easy. And it can be very challenging. So I know how that goes, but I also know how rewarding it is to transform a person's life. And it's really incredible. And I just thank you for doing it.
Oh, thank you so much for those beautiful words. I really appreciate it. Thank you.
Absolutely. Yeah. Thanks for coming on.